Besides lifestyle change and medication treatment, there are other modalities of treatment for obesity. Here, I would like to briefly discuss the devices, procedures, and surgeries for weight loss. I will focus on the Plenity capsule, the AspireAssist system, intragastric balloons, and weight loss surgeries. First, Planity. Although the Planity was cleared by the FDA as a device for the treatment of overweight and obesity, it is actually an oral capsule that contains naturally derived cellulose and citric acid. 3 capsules need to be swallowed with 16 ounces of water 20 minutes before lunch and dinner. Once inside the stomach, the capsules release hydrogel particles which absorb water and expand to the extent that they occupy about a quarter of an average stomach volume. With the expanded hydrogel particles inside the stomach, people will feel fuller much quicker after eating a smaller amount of food. The hydrogel particles pass through the digestive system and break down in the colon where the water is reabsorbed. The non-absorbable Planity particles are eliminated through the normal bowel movement. Studies have shown that 60% of people taking Planity lose an average of 22 pounds in 6 months. Planity costs about $99 per month. Currently, it is not yet widely available in the United States. Second, intragastric balloons. The mechanism of intragastric balloons for weight loss is very similar to that of Planity, which is to occupy the space inside the stomach and to create a sensation of fullness after eating a small amount of food. Here, I will focus on 2 types of intragastric balloon, the Orbera and the Obalon. The Orbera balloon needs to be inserted through the mouth, down the esophagus, and into the stomach with an endoscope. Once inside the stomach, the balloon is inflated with a saline water to expand to the size of a grapefruit. In contrast, the Obalon balloon is swallowed and the balloon inside the stomach is inflated with gas. A total of 3 Obalon balloons are swallowed over a 2-month period. The total volume of the 3 balloons is 750 cc, which is about 25 ounces. After 6 months, either type of balloon will be deflated and removed endoscopically. The average cost of an intragastric balloon with procedure is about $10,000. Third, the AspireAssist device. The AspireAssist system is a device that helps reduce the amount of food that the body absorbs. A tube 6 mm in diameter with 5 holes is placed inside the stomach endoscopically. The tube connects to a skin port on the surface of the abdominal wall. 20 to 30 minutes after each meal, a connector with a water reservoir and a small device called companion are attached to the skin port. After the valve in the skin port is turned on, the liquid and small pieces of food inside the stomach can be drained by gravity through the tube into the toilet. The water in the reservoir is then squeezed into the stomach to loosen the food. The stomach can be repeatedly drained until about 30% of the food is emptied. AspireAssist helps people lose about 14% of body weight in 1 year. The average cost of an AspireAssist placement is $10,000. Lastly, weight loss surgeries. The cartoon on the left illustrates the adjustable gastric band procedure. It is the least invasive surgery. During the procedure, an adjustable silicone band is placed around the upper stomach to make a small pouch. The silicone band is connected by a tube to a port under the skin of the abdominal wall. Through the port, saline solution can be injected or aspirated to adjust the narrow opening between the small stomach pouch and the lower part of the stomach. People will feel full quickly after eating a small amount of food, and the food in the small stomach pouch moves down slowly into the lower part of the stomach due to the restrictive band. The middle cartoon demonstrates the gastric bypass surgery, also called the Roux-en-Y surgery. It is the most commonly performed bariatric surgery. It causes weight loss by limiting food intake and by decreasing food absorption. During the surgery, a small portion of the top of the stomach is sealed off from the rest, creating a pouch about the size of a walnut that can hold only 1 ounce of food. The pouch is then sewn to the middle part of the small intestine. The food eaten bypasses the rest of the stomach and the first section of the small intestine. The cartoon on the right shows the vertical sleeve gastrectomy. During the procedure, about 70% of the stomach is removed, resulting in a narrow gastric tube or sleeve. The surgery reduces the size of the stomach and limits the amount of food that can be eaten at one time. People will feel full quickly after eating a small amount of food. The sleeve gastrectomy can also cause a decrease in appetite by reducing the amount of a hunger hormone called ghrelin produced by the stomach. Different types of surgery achieve different amount of weight loss. As you can see here, the gastric bypass surgery is the most effective. It contributes to 71 pounds or 26% of weight loss in 5 years. In contrast, the sleeve gastrectomy results in 19% of weight loss. The gastric banding leads to the least amount of weight loss, which is 12% in 5 years. In summary, there are different modalities of treatment for weight loss in addition to lifestyle change and medications. The devices, procedures, and surgeries discussed here are indicated for different groups of people. Please consult your physician to see if a specific treatment is right for you. Thank you.